Hello everyone. Today's video is about natural solutions to help constipation without causing subsequent bloating. As per usual, nothing that I'm talking about today in this video should be construed as medical advice. This is for informational purposes only. If you need any medical advice, please talk to your healthcare provider to get that advice. So someone had asked the question, what can one take to help with constipation without having bloating as a side effect? So pretty straight and to the point. And so it's a very good question because constipation is a major issue for some people. Sometimes it's incredibly severe, sometimes it's just mild, but either way, it's nobody likes it. There's just a few things that are better in life than having that daily bowel movement at least, and if you don't have it, it's just life's not so good, or not as good as it could be. And then I think the subtext there with asking what can one take to not have bloating, as part of the a side effect of trying to help with the underlying issue is that a lot of fiber supplements, things like Metamucil and other sources of psyllium husk and oat fiber and different things like that, can cause bloating as a side effect. I mean, quite frankly, oftentimes do cause bloating as a side effect, at least in my experience with my patient population. Now, there are some types of fiber that seems to be better tolerated than others. I interviewed Dr. Kathleen Janelle during for my Overcoming Chronic Illness podcast. We talked a lot about MSM therapy, high-dose sulfur therapy, which can incidentally be a solution for some patients for constipation. But one of the things that I don't think we talked about it during the interview, but I think it was in a subsequent correspondence that I had with her, she was talking about using something called acacia fiber. So acacia fiber, tomato. It's a type of fiber that evidently doesn't really get fermented in the small intestine. It largely gets fermented in the large intestine, and so that can sometimes be a less bloating prone type of fiber to take. Now, to be honest, I don't have a ton of experience with acacia fiber. I have recommended it to a number of patients. It's not something I've used with many patients over the years because I have other solutions that I typically use for constipation, but I do have some patients who have reported benefit from it. So that is anyways, on the fiber topic, there may be some types of fiber that are better tolerated than others. Also, in my earlier years of practice, I used to use larch fiber all the time. So basically, the powdered bark from larch trees contains something called larch arabinogalactans, which actually have some immune system boosting properties, and it's a nice soluble fiber. Pretty easy to get into kids. It doesn't taste bad, and that could be a better tolerated fiber, probably because it's mostly soluble fiber, which seems to not exacerbate bloating as much. Anyways, with all of that being said, the solutions that I typically work with my patients to help with constipation are, well, of course, we want to find the root cause of what's going on. Do they have some type of, SIBO issue, methane gas producing SIBO, or EMO as it's called, intestinal methanogen overgrowth, IMO. That's commonly associated with constipation, although some patients with methane gas producing SIBO/EMO don't have constipation, so it's not always the case. Other types of SIBO as well, hydrogen and hydrogen sulfide gas producing SIBO, can sometimes present with constipation, although usually it's more diarrhea, if anything, or just normal bowels. So it could be a SIBO issue, could be a yeast overgrowth issue, could be a parasite issue. It could be related to an impaired intestinal motility because of an underlying sulfur deficiency, maybe because of an underlying impairment of the nervous system regulation of the gut. So maybe excessive stress is causing bowel movement impairment. Maybe there's a vitamin B12 deficiency going on. Maybe there's some type of thing like mold toxins or something else that's just putting a lot of physiological stress on the system, and that's contributing to constipation. So treating the root cause, of course, is really important, but sometimes it takes a while to find the root cause, and then once we found it, then addressing the root cause can take a while as well. So what are some good interventions or natural treatments that can be implemented while working on the root cause? So hands down, my favorite thing to work with that is successful in over 90% of cases is using magnesium supplements to help get the bowels moving. Magnesium acts as an osmotic laxative, so when we take enough magnesium, it helps to it draws water into the bowel and causes a bowel movement. It works through the same mechanism as other osmotic laxatives like PEG, so products like Laxaday or Restoralax. I'm sure there's other products out there that have PEG in them, PEG, but that's also an osmotic laxative. So when the PEG doesn't get absorbed at all in the intestinal tract, because it's not food, it's actually a petroleum byproduct, interestingly enough. So what can't you make out of petroleum? Gasoline, diesel fuel, plastic, clothing, PEG, like just man, oh man, that those fossil fuels, what can't they do? So when the PEG hits the intestinal tract, it also draws water into the bowel, and then that has the osmotic effect that we're looking for there. Vitamin C can do the same thing. MSM purportedly can do the same thing, although I have lots of patients who build up to a very robust dose of MSM and they don't get a laxative effect from it, although it can help with bowel movement normalization. So it's kind of a different kettle of fish there, but sometimes MSM is thrown into that category. And indeed, if someone goes on a high dose of MSM very quickly, it can have an osmotic laxative effect. Inositol will sometimes cause that. So anyways, there are other things that have osmotic laxative effects. So I really like magnesium, particularly magnesium glycinate, because unfortunately, I'm not aware of any studies looking at this, but from my clinical experience, as best I can tell, I think with magnesium glycinate, I'm quite confident that with magnesium glycinate, we actually are getting kind of the best of both worlds in that it's correcting a magnesium deficiency because it's a very well-absorbed form of magnesium, and then it's also giving us that osmotic laxative effect as well. So I've had many patients over the years where they don't have SIBO or yeast overgrowth or whatever, like they have constipation for some other reason. And I think in some cases it's due to a magnesium deficiency. And so they take the magnesium glycinate, they build up to a dose that's getting them to have a daily bowel movement, which is great. And then over time, the dose that they need starts to go down. And in some cases, the patients kind of whittle down to a maintenance dose and they need to continue to take a certain dose of magnesium to keep their bowels moving well until we figure out the root cause. But in a number of cases, they whittle down the dose until they don't need any anymore, and then they are good. Their bowels are moving regularly now. And in those cases, I think we're actually correcting a magnesium deficiency, because if we don't have enough magnesium, our muscles don't fire properly. They tend to go into spasm. We can get muscle cramps, we can get restless legs, different things like that. And I believe that not having enough magnesium for the smooth muscle of our bowels can also lead to constipation. The way that I describe it to my patients all the time is it's a little quasi-graphic here, but we're all grown-ups here, so I'm sure we can handle this. So when we have a bowel movement, it's kind of like squeezing toothpaste from the bottom of a tube all the way up to the top of the tube. So if you were to say, we all know to get that last little bit of toothpaste out of there, it's like you put your fingers at the bottom and then, just push all the way to the top until the toothpaste comes out. You don't just randomly pinch at, random places in the tube, because then the toothpaste is just going to move back and forth and it's not going to all come at the top where you want it to. So in a similar manner, we have these peristaltic contractions where basically there's these rhythmic contractions that basically push the stool from one end of the bowel to the other. I mean, not all the way from the start of the ascending colon, it's really the last one half to 1/3 of the colon. But anyways, those peristaltic contractions start to move things along the way, kind of like squeezing toothpaste out of a tube, and then out comes the bowel movement and everybody's happy. If on the other hand we have, if there's some smooth muscle spasm there, then my belief on it, and again, I don't know of any studies looking at this, so that's why I'm saying I'm not trying to present this as a fact, but I believe this is what's happening. It's kind of more like, trying to get the bowel movement out with kind of the random squeezing along the toothpaste tube, so to speak. So if there isn't that nice coordination of those peristaltic contractions, then there's going to be an incomplete evacuation of the bowels. And I've seen that in so many patients. I've had so many patients, they're like, yeah, I have a daily bowel movement, but it doesn't feel like a complete satisfying bowel movement. And some of those folks, they go get, an abdominal x-ray, and they see like they're just full of stool. They're just completely full of it. And so the stool's like caked onto the side of the bowels. It's not good. One of the beautiful things with, beautiful being a relative term, I guess, one of the very wonderful, very handy things with using a osmotic laxative is that the water that's pulled into the bowel is actually pulled through the walls of the bowel. And so it's actually, I kind of describe to my patients as it's pressure washing anything that's caked to the sides of the bowel. It's kind of pressure washing it off from the outside in. So over what I've seen in a number of patients is at first they might need a very high dose of magnesium, and then they'll rapidly have a decline in how much they need to take because they've kind of presumably pulled off all the caked on stool, and then now things are, the walls are cleaned off and everything's going quite a bit more smoothly. So magnesium glycinate or other osmotic laxatives are very high on the list for me, and it's very, very rare that they cause bloating. I've had a handful of patients over the years who get bloated taking magnesium. If they do, it's usually transient, and I think it has to do with the shifting microbiome in their guts, and usually they'll tolerate it really well. But I do have a few patients where they're just like, yeah, magnesium bloats me, and it doesn't really make sense as to why that would happen, but that's what gives me so much gray hair, because medicine is tricky and challenging, and there's always going to be exceptions to rules and curveballs and all that, but it keeps it exciting as well. So there's that. In terms of other options for removing the bowels that have a non-bloating side effect, sometimes increasing dehydration can lead to constipation. So if one's not drinking enough water, that can be an underlying problem. Sometimes getting more fat in the diet can be really important. So there's some studies looking at just taking 1 or 2 tablespoons of olive oil a day, and that can help to improve reduce constipation symptoms. I've had a lot of patients when they've brought more fat into their diet, just in general, like if they're, say, going on a carnivore diet or a modified ketogenic diet, their bowels actually start to move better because they're actually eating more fat. So that's another possible solution. There are also drugs out there, like there's one called precalipride, also known as Resitran. That's oftentimes used in SIBO to help with motility issues, so that can be a helpful adjunct. Beyond that, those would be the main ones that I use. And then, of course, there's old-timey things like prunes and things like that can potentially be helpful. But yeah, those are my main thoughts. So I'll leave it there for now. If you don't mind taking a quick moment to please like, share, subscribe, and or post a quick comment on the video, I'd really appreciate it. So thanks in advance for taking a second to do that. And any questions on this topic? Lovely topic for today. But any questions on constipation, anything to do with the digestive tract, or just anything about health in general, particularly complex chronic illness issues, please post in the comment section below, and I will do my best to answer as soon as I can.